Okay, so today we've had a patient come into the clinic with pain in her forefoot. So this is between the second and third metatarsal heads. So that's where the pressure gets created. You get this sort of compression pressure and shearing pressure between the two metatarsal heads. So what we go ahead and do is, of course, as we always do, remove that overlying callus so we can see what's going on under there and what might be causing the pain. You can see it become a little bit more apparent when we look at the central callus section, and there you can see there's a hard section. Putting that little bit of rubbing alcohol on there just helps us to see through it so we can actually see what we're cutting away. And now this is a hard corn or haloma durum. So of course we just need to enucleate this one, get the hard sections out. Because of the shape and the size of this one, we're pretty much able to use the 15 blade here just to cut the edges so they're not really aggressively steep, and then we remove as much of it as we can without actually coring out the center, because usually when we core out the center, it's just gone off screen there a bit, that's when you get the pain. So we basically remove as much without using the sharp tip of the blade as we can. And then you can see now they've got that central section. We need to go in just around the edge, and you can see the macerated little white ring around it. That's when the corn pushes on the skin and pushes the tissue fluid back out of the corn section of the skin into the surrounding tissue. So we'll just cut around that edge, because we can usually do this without blood, and it's not particularly painful at all. It might be a little bit uncomfortable, like you're pulling out a hair or just some slight sharpness there as we go around the edge. And then we remove the entire central section, and then it helps a ton with the pain. So it's pretty important to get these ones treated, particularly in elderly patients or diabetic patients, because they can cause ulcerations, infections, and that can lead to amputation quite quickly in a diabetic. So you can see me here just going in with the blade, just going around the edges. It's not a particularly sharp-shaped corn, so it's not a particularly painful one to remove, but it's really painful to walk on because it's such a big corn. This one, you can see it's really probably about 8 mil in diameter. So we'll just go ahead, continue removing that one, just gently sort of lift that out, cutting and lifting at the same time. The slower we do this, the less pain you feel. So if we can do it really nice and slowly, it's of course the most agreeable to the patient. So keep going and keep removing this one, keep trimming it out, and you can see it's really coming out in one nice big chunk. So it's going to be pretty satisfying to see this one if we can get it all out in one go and actually show it to the camera if we stay on camera. And then you can see now that's the central section. It's not particularly sharp. It's more shaped like a half a pea. So we can just go back in here, clean up the edges, smooth down with the rotary sander. Advise the patient to get this one treated more regularly, because we can break the hardening cycle and hopefully reduce the size of the corn so it won't be as painful. Moisturizer as always, change the footwear, put a little soft insole in the shoe with a metatarsal dome to deflect the pressure. And that's how we treat a really severe hard corn in the forefoot of a patient with no complications.